Medical technology is the title for our group. And to give you an introduction about medical technology can be defined as the technologies that diagnose, treat, and or improve a person's health and well-being, encompassing both low and high-risk medical devices, products that can be as varied from tongue depressors, surgical gloves and medical thermometers, to insulin pumps and pacemakers and in vitro diagnostics, and used to save the lives of patients everywhere across Asia Pacific every day. Medical devices assist healthcare professionals to diagnose and treat patients with a higher level of accuracy and in a timelier fashion, and help patients overcome sickness or disease, improving their quality of life. And while a global definition of what defines as a medical device is difficult to establish due to the various regulatory bodies worldwide that oversee the use and categorization of medical devices, there is a very high likelihood that people are surrounded by medical devices without even realizing it. And this is a sample video of a medical technologist on how they work inside the laboratory.
When a doctor orders a series of tests on a patient, it's the job of medical and clinical laboratory technologists and technicians to prepare and perform those tests to help detect diseases or abnormalities. These professionals analyze body fluids, tissue, and cells. Using powerful medical equipment, they look for bacteria, parasites, and abnormal cells. They also analyze cholesterol levels and cross-match blood samples for transfusions, documenting their results in reports or patient medical records. Since they regularly handle samples and medical instruments contaminated by infectious microbes, they wear protective goggles, gloves, and masks to minimize the risk of contagion. In larger labs and hospitals, technologists and technicians tend to specialize in areas like blood work or microbiology. Most work full time. In general, technologists supervise the work of technicians. Technicians need an associate's degree in clinical laboratory science, and technologists need a bachelor's degree in medical technology or life sciences. Licensure is required in some states, and certification is often preferred by employers. The work can be stressful, especially when they must perform complex tests accurately and in a limited time. However, they gain satisfaction from knowing they provided the vital information doctors need to save lives or cure diseases.
And lastly, to give you an overview about the medical technology. Medical technology includes medical and surgical procedures like drugs, equipment, and facilities, and the organizational and supportive systems within which care is provided. This definition focuses on equipment, systems, facilities, and procedures, but not drugs. There are considered to be two tiers of investigation in medical technology assessment, given that it is the evaluation of the effectiveness of equipment, systems, and procedures in treating or preventing disease or injury. For the primary, clinical safety and effectiveness in terms of physical indicators of patient care outcome. And for the secondary, it is synthesizing the results of clinical impact to project financial outcome and, and reimbursement decisions for payers. And that's all for our report. Thank you, ma'am.